Good afternoon, everyone, and then welcome to our roundtable discussion with for Acdhpr. We're happy to have you all join us for this roundtable. My name is Festus Adedoyin, and I am the founding fellow at the African Center for Digital Health Policy Research. And what we do is to connect the dots in terms of bringing health care service delivery in Africa together with IT and technological development and advancement in Africa, as well as the role of policy. So these three arms, we connect them together in what we do at the African Center for Digital Healthcare Research. Today, we are looking at the Gambia. So in the past, we have had different discussions looking at different aspects of countries in Africa and looking at different issues within the African context. And today, we are exploring the Gambia, looking at a specific issue, which is about smart immunization. But before we go on, I'm going to introduce, before I hand over to our speaker, I'm going to introduce our speaker, and then I'm going to give the floor to him. Mr. Khalifa Sane Daboe is a Gambian by citizenship, is a laboratory scientist with over 10 years of experience working in terms of preparing, analyzing, and reporting quality data for the epidemiological investigation of infectious diseases. He has extensive work experience in bacteria isolation, DNA and RNA extraction and purification, PCR, biofilm, assay preparation, Western blot and gene sequencing, basic laboratory techniques such as analyzing and examining clinical samples. Mr. Sane Daboe has vast experience in the Gambian Ministry of Health, dating back to 2012 as a laboratory scientist. In 2014, he rose to the post of a senior laboratory scientist, and currently he is a principal laboratory scientist at Kanifing General Hospital, Kanifing in the Gambia. Mr. Sane Daboe also doubled as an adjunct lecturer and the head of department of MLT at the American International University in West Africa. Mr. Khalifa Sane pursued his undergraduate studies at the University of West of England from 2008 to 2011, where he bagged bachelor's in biomedical science. In 2016, he was awarded a prestigious Korean government scholarship to pursue one-year Korean language and culture studies at Ewha University in Seoul, South Korea. After successful completion of this program, Mr. Sane Daboe in 2017 joined Chonam National University to study for his master's in biomedical science. He's currently pursuing a certificate program in clinical epidemiology at Utrecht University in the Netherlands. Mr. Khalifa Sane Daboe is also a researcher who has published in several papers. For example, he's published the antimicrobial susceptibility of Staphylococcus species isolated from prosthetic joints with a focus on a particular mechanism. We're very pleased to have Mr. Sane Daboe today. He's currently working on several other papers in trying to assess antibiotic utilization at Kanifing General Hospital and other researches such as antibiotic susceptibility patterns of bacteria isolated from patients with community-acquired urinary tract infections. We have a very rich resource person here with us today, very vastly experienced in the health sector, and will be sharing with us some of his experiences in the area of digital health and how policies can be enhanced in Africa particularly focusing on the case study of smart immunization in the Gambia. Please join me, everyone, to welcome Mr. Sani Debois as I hand over the floor to him. Thank you. Over to you. Thank you.
Thank you very much, Doctor. That was so kind of you. Thank you. And thank you, everyone, for your time. I hope I'm going to do justice to this very interesting topic, exploring digital health interventions in Africa, a case study of smart immunization in the Gambia. I also hope, the little time I have with you, I would do justice to this very important, very crucial topic. Good afternoon to you all. So I hope you are all seeing my screen.
Yes, sir. We can see your screen. Thank you.
Very good. Thank you very much. So I've got a few slides to introduce the topic. Okay. Digital health.
Sorry to come in very quickly, sir. Could you make it full screen so it's just accessible? It's a bit bigger for everybody to see.
Okay.
Thank you.
Would this help?
Yes, that's better. Thank you very much.
Yeah, very good. Well, thank you very much once again. I'm going to briefly introduce you to digital health. Digital health isn't a new thing. It's been in existence for the past 100 years with the medical images and telemedicine. Then in the 1940s, the introduction of prototype wearable devices were introduced to tackle obesity in the United States of America. Then again in the 1990s, the US National Academy of Medicine recommended the digitalization of health data. This has seen the digitalization of health data like immunization, health demographics, and so on and so on. So now the healthcare is moving towards personalized paradigm with support real-time monitoring, as you'll see in the presentation. Now with the introduction of smart technologies, healthcare is being personalized, and also you can see data in real time as well as monitoring. So what are electronic immunization registries? Now, as you all know, these are tools that help to monitor real time the individual immunization schedule and the storage of individual immunization histories. They are very, very useful. They also help to enhance the performance of EPIs, the expanded program on immunization, in terms of not only coverage but also efficiency. The coverage is bigger as well as the efficiency. So I will introduce you to the brief journey to the introduction or the launching of digital immunization in the Gambia. So this is how the journey starts. Back in 2016, the Gambia government, in collaboration with its partners, signed an MOU. Partners like ActionAid the Gambia, Shefo Foundation, and other partners. So this intervention implemented a novel hybrid paper digital solution. Basically, they modernized the HMIS system, the Health Management and Information System, which was used to input data. Now, this helped to share, store, and distribute data for the expanded program on immunization using smart paper technology. So 2 years later, down the lane, there was an evaluation of the data quality and operating costs for the smart paper technology in the Gambia. So first it was piloted in 4 fixed and 14 outreach health centers. across Western Region 1 and 2 of the Gambia. So the findings were very outstanding. They are very, 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 very informative. There were some recommendations, and one of the recommendations was to scale up the solution in 2 regions, which was subsequently agreed by different partners, the Action Aid, the SHIFO Foundation, as well as the Gambia government. So in the same year of July, the scale up of smart paper technology commenced in Western Region 1 and 2. And this helps to enhance solution in all health facilities, health service delivery points. Then a second independent evaluation was summoned. Now, this second evaluation took place in 2019, and the main focus were the data quality, data usage, administrative time efficiency, and administrative time efficiency. So the piloting was very successful, and this was backed by the findings of external evaluators. So what then are the benefits of electronic immunization registries? Like I said, the new health information management system was able to help the Ministry of Health of the Gambia to keep track digitally of all children under 5 with regards to their vaccines or their immunization schedules. It also reduces, the workload administratively, the time of healthcare workers during service delivery. Now, the times, spent by healthcare workers on administrative work was reduced, thanks to the help of this, modernized and innovative technology. It also allowed decision makers at Ministry of Health to monitor real life, the progress and performance of facilities based on key performance indicators. Additionally, like I said, the external evaluation of the project have shown that the solution was expandable to cover the whole primary healthcare facilities in the country. This is why after the the external evaluation report, the program was expanded across the country. Now, what have they done at different levels? So at the community level, families with children and women of children age receive an SMS text message. Now, this was to inform them a day before their due date for vaccination. So it was very crucial at community level in informing parents, especially women of childbearing age, of their subsequent or their coming vaccination dates. So what does it do to the healthcare workers? Healthcare workers receive their key performance indicators and develop strategies. This helps them to develop strategies to improve coverage, equity, those who need it and at what level do they need, and also quality of immunization service in underperforming areas. It was very useful for healthcare workers to monitor real life, and also to gauge as to which area is underperforming or which area is performing well. And underperforming areas, where, equipped with, services that were lacking. So it also enabled the automatic generation of request forms, as you'll see in the subsequent slides, used by provincial medical stores. So this also incorporates the delivery of vaccines and other supplies to each health facilities across the country. Lastly, decision makers and planners at regional and national level were able to review performance of each health facility using the integrated dashboard and reports. Now, this insight gives them the opportunity, the decision makers and planners, to deliver the required health service to regions that were underperforming. So these are the outcomes of the external evaluation team. The data quality assessment was based on the WHO data quality review toolkits. Now, the reports indicated that 100% consistency and the incident of recording error were only 2%. Although this, looks significant, but with regards to the project, it was very, 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 it was very significant. The consistency of 100% was very significant, and the data accuracy was rated at 98%. So looking at this, the time spent on data administration per child to be fully vaccinated and receiving the required vitamin A and the deworming vaccines were decreased by 59%. Considering the traditional way, the 59% decrease was very, very, very significant. How about the cost? For the cost analysis, the smart paper technology solution costs only $364, compared with the printing existing of health management and information system tools, which costs about 3.2 million and 2.8 million respectively. So if you see the difference in cost analysis is quite huge. Comparing smart paper-based technology and the old system. So the three teams emerged from the caregiver interviews. Caregivers were interviewed, and the three fundamental themes that emerged from that interview were the usefulness of the SMS reminders. Like I highlighted before, the SMS reminders serve as a kind of reminder to the childbearing parents as to their vaccination schedule. 2, the practical benefit of My Child solution for caregivers. Now, they introduced a project called My Child Solution, which aim at reaching to every child at every corner of the country. Thirdly, the caregiver wishes related to immunization activities overall. They were able to gather information as to how caregivers wish to relate to immunization activities. So what then are smart paper technologies? It's an innovative digital mother and child health system, which is based on smart paper technology. The innovation not only allow for mother and child health data to be captured on the paper, but it also enables the provider to be able to scan, digitalize, and upload onto a hospital management system. It's very, very clever. It doesn't rule out filling the paper. You still fill the paper, but what you do after that, you scan it to digitalize it and upload it onto a hospital management system. So the SPT, the smart paper technology, delivers all the benefits of electronic health record system, as I alluded to in the previous slides, and enables smooth implementation in clinics and other health facilities across the country. This is done without electricity, connectivity, and security. You don't need to worry about electricity supply or connectivity or security. Recording on paper forms means that number of potential errors. But with the introduction of this SPT, errors are reduced by 72%. Implementation and maintenance is also faster compared to the old system. It's more affordable compared to other technologies. Now, this is how it works. The paper base is filled. Once the paper base is filled, it's scanned. and then digitalize by scanning, and then share with the hospital, management system. So these are the outcomes so far. So far, the project was able to register 350,000 plus children across the country. There were 115,000 and above children fully vaccinated. These were, very good success stories for the projects. 550,000 and above SMS follow-up were sent. So, notwithstanding, just like any other projects, the project is faced with some challenges. The technical know-how, the conformity to the new technology. It took some time before some healthcare workers, were able to conform to the new technology. Also, the availability of the smart paper technology equipments in some facilities, the delayed delivery was another issue. So with this, I end my talk, and thank you very much for your kind attention. And back to you.
Thank you. Thank you very much for that very insightful discussion. I mean, this is a very interesting technology. It's to me, it looks very affordable, and ease of usage as well. It looks as though people can they can explore the use of this technology without much hassle. I'm sure my team, my colleagues here have a few questions. So I'm going to be opening up the floor for my team members to ask questions, and for you to react to those questions. But before they do, I have a question, and that's about the acceptance in terms of the politics behind it. Was it always very welcoming, to the government or to the funders in terms of implementation? As you know, change is one of the difficult things for most African governments. It's not always easy. On paper, we can talk about it, have roundtables, discuss it. Tell them about the technicalities, how it's going to work, even show examples of where it's been applied and it's worked successfully, and all of those nice, presentation can be made. But when it gets to the regional government or the central government, there might be a bit of kickback and challenges. I just wondered if you have some insights into how this worked, the processes, and how they were able to fund this and support this and implement it nationwide in the Gambia. Thank you.
Very good. That's a very good question. Just like any other project in Africa, the political will have to be there. And this was not different. It was well contested. This is why, like I stated in the journey started back in 2016. In 2016, when it was first, piloted in 2 regions of the Gambia, of 2 regions in West Coast region of the country. But after the first external evaluation report, were submitted, government was able to gauge and, conclude that, well, it was worth, the project to roll to other part of the country. Yes.
Thank you very much. That's interesting to see that it was piloted in terms of, because that's one thing, I think one strategy to always use to get the government to listen. You pilot it in a very, nice region of the country, more like on a small scale, and then produce evidence that this can work, and then, launch it more on a national scale. Thank you very much. I think we have a question from Usman.
Very well. Yes. So sorry, before I go to the next question, I might want to add this. Obviously, we have to acknowledge the hard work, the collaboration of different partners like the ActionAid, the Gambia, Shifor Foundation, and other very important partners. So, if it wasn't their, untiring effort, the project would have failed. But they sponsored and then they were able to engage the government and other stakeholders, into this fully.
Thank you. Thank you very much. That's a very important point you've made there. That stakeholders could partner. I think is a very big problem in Africa where one NGO, one government arm is doing this, and this other government arm is doing that, or that other organizations are doing that, and so there's no synergy across different organizations really coming together to make it work. Thank you very much for that. Usman, sorry for keeping you waiting. Please go ahead.
Thank you very much, Dr. Thank you, Khalifa Sane Tabo, for that very brilliant presentation on the smart immunization. I have two questions. One is regarding the comparison you made between the paper-based and the smart paper system. You gave some amount of money. So I want you to specify which currency are they. Is it in the Gambian dalasi or in US dollar? The second point is looking at issues of immunization. Sometimes there are so many issues that other people will tend to bring, like immunizations are done in order to avoid people having numerous children, particularly in Africa. It's like this is something that is infiltrated in many provincial areas in the Gambia. What has the ministry done in order to work with the local authorities information and also to ensure that the provincial indigents also take part in this smart immunization act?
Well, thank you very much. First, on your first question, the cost analysis was done using the US dollar, because like I said, it involved international partners like Shifor and ActionAid, the Gambia, and other partners. So all cost analysis was based on US dollars. So coming to your next question, your line was a little bit bad, but just correct me in case I got you wrong. I believe you asked about the myths, the conspiracy theories, on immunization. Am I right?
Right. You are right. Yeah, and also the involvement of the local and traditional leaders, in convincing the masses about smart technology.
Very well. Thank you very much. Concerning the conspiracy theories, Gambia is not an exception. Just like any other vaccine. In fact, currently there's a lot of conspiracy theories on this COVID vaccine, across even, this so-called civilized world, the Western world. But, the Gambia was able to involve partners like the health promotion and communication, which helped to disseminate and also counter the false, rumors and also the false conspiracy theories against immunization in the country. And of course, the Gambia is just, opportune to have, local groups called the Kanyalings. These are local groups, that help to disseminate, that help to share information, especially health-related informations. So the project also make the best use of those local groups. They help to disseminate, they help to sensitize, especially on the importance and the value of immunization, especially for under fives. So, the project was very successful in making sure that, the information is filtered down to the last person, to the last corner of the country. And that's one of the milestones of the project.
Yeah, thank you very much. Thank you very much. Well answered. Thank you. Over to you, Doctor.
Thank you. Yes, thank you very much for that brilliant response. I think we have for Lion Adini, your hand is up. Please go ahead. You can unmute and ask your question. For Lion Adini, you can. Yes, go ahead.
All right. Thank you so much, Dr. Festus. And I also want to appreciate Dr. Khalifa. Thank you for this insightful delivery. Questions. Number one, just like you said, that there were some technical issues. So the first question I want to ask is this: how do you intend to back up your data? Because I know that over time, it is very possible that we have lost information. We have lost. So how do you intend to back up data to store it up over time? Is it going to be with individual hospitals, or is it going to be a central thing? That's the first question. Then my second question to you is this, sir. I know that one of the issues we have had in Africa over time is continuity. Of course, this smart paper technology has been on ground for about 6 years now, if I'm not mistaken. But how do you intend to ensure that this continues? So these are my questions. Thank you so much, sir.
Very good. Thank you very much. Data security is fundamental, and privacy is also important, and confidentiality. Having said that, the project is able to cater for all of this. In the near future, the project is, the project aim to harmonize, the data with the district health information system, the DHIS, which captured, all the data like the COVID and the other data. So storage wouldn't be a problem. But for now, like I stated, the data is managed at the district or health facility level. So coming to your next question, sustainability. This is another issue that was talked about and was looked into. Well, the project realized that when you give people the ownership of projects, it's well taken care of. And like I said, the project aims to cover every child at every corner of the country. And the ownership is given back to the beneficiaries, the childbearing, mothers. Of course, like I said, the political will have to be there, and the sponsors obviously, will conduct, routine, external evaluation to report on the shortcomings of the projects, and also, how best to improve the system.
All right, that was beautifully answered, Doctor. Thank you so much, sir.
Thank you very much for that question, and thank you for answering that question very brilliantly this time. We have a few questions. The first question is from Tony. I don't know if you want to unmute or you want me to ask. Is in the chat, but would you like to read the question, Tony? Or okay, I don't know if I missed that, but Tony would like to clarify how stakeholders were brought together. And secondly, if the smart immunization is a public sector-led project or, private-led or otherwise. And the second question was the context to his question was more like to know, where's the money coming from, who is paying for this and things like that. So is it possible, for us to try this sort of innovation with other kinds of medical solution? Yeah, thank you.
Very well said. Just like any projects, before you roll out, you do some feasibility studies. This project too, is not an exception. There were feasibility studies done. For example, like I stated in the presentation, with the paper, with the manual base, there were a lot of time spent, administrative time spent. There were a lot of errors, and so on and so forth. So it was Schifo Foundation, Gavi, Alliance for Vaccine, the Gambia government, Action Aid, the Gambia, that came together. It is a joint, public and private sector, actually. It's not only public or private, it's a joint public and private sector project. And of course, the project can be, rolled out in Nigeria. Gambia is not the first country. Uganda is also benefiting from the same project. And they are registering a lot of benefits. They too, just like the Gambia, have registered, a lot of benefits in terms of money spent, in terms of time spent, on paper base, and also the security. Because the old way of doing things, costs not only a lot of money, but also is prone to a lot of mistakes. So, but with the introduction of this new technology, it's not only timely, it's cost effective, and also you can watch or you can monitor progress, in real life. Yeah.
Thank you very much, Khalifa, for this. I think the next question is from Acdhpr. Based on your experience, are there any project-specific recommendations for other nations considering this project? So if there are other nations that are thinking about this kind of projects, are there any specific recommendations for them, like prerequisites, standard requirements, what you need to have before you embark on this sort of project? And can it be sourced publicly or privately? I think you partly answered that in this case of Gambia, but what are your own recommendations for that? Thank you.
Well, thank you very much. The project can be piloted in other part of the world. Gambia, records will attest to this, has achieved or has got one of the best records in terms of immunization. Gambia's immunization coverage is one of the highest in the sub-region. So because of that, the project, aims and objectives were easy to achieve. Having said that, all projects, in fact, no projects succeed without, overcoming challenges. Some of the challenges that they face is conformity. Is conformity, how people would, give away their old, the old style of recording on paper and storing on, record offices and so on, to this smart technology. So conformity was one challenge. The other challenge was, how to sensitize people. Sensitization is a key factor in rolling out this project. this is why it took too long, up to 6 years. Like I said, the project was piloted in 2016 and it was launched in this year, 2022. So for the past 6 years, they were sensitizing people. And like I said, the local Kanyalens, the other partners, and also the Minister of Health, Department of Health Promotion and Communication also play a vital role in making sure that the information reach the people who need it most. Yeah.
Thank you very much. That's a very brilliant response there. So people continue to partner together, and that groundwork took 6 years before it can finally be launched. That's good to know. And to see that another government hasn't just come and sort of rolled it off, and that continuity, and conformity as well, to let people know, because one of the big problems with a country like Nigeria with over 200 million population is that sensitization. So that's going to be a very big project to make people learn and know and accept to do that. So it's going to cost a lot more for a big country like Nigeria, unlike Uganda and the Gambia, So it's good to always have that, country-specific features captured into the planning and the design of the solution. Thank you very much for that. I think one final question, we're going to be closing soon, but one final question is from Hayong. Hayong is asking, how does the data collection and stakeholder monitoring and evaluation progress affect this particular effort in the Gambia, especially when you did a pilot? Were there any challenges that influence or affected your baseline study? Because sometimes you do your baseline, then you get to the market and it's all very different what you encounter. So how do you manage that aspect? Thank you.
So if I may get the question right, did you say the challenges?
Yes, the challenges in data collection versus stakeholder monitoring and evaluation. Because sometimes I was thinking about how, for example, you mentioned like 3 different stakeholders.
Yes.
AIDS UK or
yes, ActionAid, the Gambia, Gavi. Actually,
yeah.
it's more than 3. The stakeholders are more than 3. The partners are more than 3. The Gambia government, Gavi, ActionAid, the Gambia, SHEFO, and 2 others.
Yeah, so bringing 6 or more, stakeholders together, some may lose interest, and PPP is very tough, public-private partnership, where somebody loses interest or say, sorry, we can't continue with this. And so how does that, all of that, interact on? How do you manage that?
Very well. That's a very, very good question. When you have many partners, control, coordination is difficult. So with this project, the project was actually initiated by SHEFO with, the help of ActionAid Gambia. So they together, help in the coordination and monitoring. And of course, like I said, the external evaluators helped to evaluate using the indicators to evaluate the performance of the projects. And for the data collection, obviously, there were a lot of challenges. For example, some healthcare workers were expecting, financial incentives and other priorities. As expected, they thought all projects come with financial incentives. This was an exception because the smart paper technology was here to stay. And like I said, it was, people were sensitized to take ownership of it. Because it's only when local take ownership of projects, that's when it lasts longer. So for the data collection, again, another challenge was in some facilities, there were some reports of inadequate electricity supply and connectivity. So, and human resources as well. So as you know, in most African countries, healthcare, workers are scarce in some part of the country. So human resources was another issue. But, the Ministry of Health, like I said, the government has to also contribute its quota. And thank God, the project was able to, have the full support of the government. And the government pledged its political will to make sure the project succeed by introducing the training and refresher training for more healthcare workers, especially in the use of smart paper technology in the Gambia.
Awesome. Thank you very much, Khalifat, for this session. I think this is very insightful, and we must appreciate you for this. We must say a big thank you for your time. Thank you for coming to speak with us. I think this is a solution that can be considered across several spheres, because it's again, it's not a very expensive solution, but although the implementation process might be a bit tough, I think the possibilities of having this work is very important. And I like that, there were a mix of different technology, very basic SMS, for example, SMS reminder, for example, very basic, a tool you could use, but also co-creating the solution with the people, the caregivers, women, mothers, fathers, or guardians, and just learning from them as well to get their own input in saying, both in designing the solution and also checking the outcomes. Thank you very much for your time today. I'm sure we will be looking forward to learning from you again at some point. We know you are very central to what's happening in health in the Gambia. So thank you very much again for your time. I don't know if you want to have any final recap or any comments.
Yes, I wanted to just comment the. Hold on. Sorry. So I wanted to comment the Acdhpr for this wonderful initiative. I think the involvement of youth in tackling some health issues and also in exploring some interventions, especially in the health sector, is crucial, because we are the future, and our contribution, our involvement will help, make a lot of changes, especially when it comes to decision making and also the implementation. So I want to commend you once more for giving me this opportunity. Thank you very much, and keep up with the good work.
Thank you. Thank you very much. That's very kind. Thank you very much for that. And we look forward to again sharing with you, and maybe when any of our fellows are in the Gambia, we'll be happy to probably meet you for a lunch or something. Thank you very much, and thank you everyone.